these applications support our vision and mission? And for us is really, how can we enhance the work of our clinicians, our physicians, our mental health providers, so we take away the administrative burden from them, either taking notes, we're exploring ambient AI as far as our EHR, and looking at options as far as how do we enhance that user interactions. So you've been to, doctors' offices, and a lot of the doctors kind of, look to the side to their computer. Wouldn't it be great if the doctor has that one-on-one interaction when they're looking directly at you and not at the machine to the side, and have all the data fed into the record, and therefore have much of a complete record. And that would free time for the physician to be present very differently than they currently are. And for our operations to provide that additional support to our end users to be much more efficient as far as, meeting nodes, or even getting insights as far as what else they could concentrate on.
No, that's great. We didn't get to talk about this, but I'm glad you actually brought up using AI in the doctor's office, because I actually just had a doctor's appointment last week, and this is about the third time I've met with my doctor over the few years, and just your normal checkup, nothing crazy. But the first thing she asked me was, hey, can I record this so I can take notes? And I'm thinking, yeah, of course. But when I was talking to her, the difference that I felt was, I felt like she was listening to me more. And then you just mentioned that your back is not, the physician's back is not towards the patient. So I did actually feel more connected with her, and it was an appointment that I think made a difference for me, because there was a moment there where I felt like she connected to me. So I'm actually really glad you brought that up. But she was like, I just need to be better at taking notes. And then I was if you guys attended the Birds of a Feather, I was actually at a table yesterday as well, where I met a gentleman from the States, and he was at another nonprofit, and also in the medical, in the healthcare, and he mentioned that's how he's also using AI as well. Note taking, improving the patient and physician relationship. So I think that's a great